My name is Pam Santamaria, and I am from Omaha. And then I went to the University of Iowa and did my medical school, and went to University of Utah and did residency, and then moved back to Omaha about 11 years ago. I have three small boys who are 8, 6, and 5, so we spend a lot of time together and we have a lot of fun. They like to be outside, so I'm outside with them a lot. We go swimming or bike riding, or in the winter we go skiing or sledding. We like to do arts and crafts. We do a lot of pottery at my house, so the kids really enjoy doing that. And we just try to be together and have a lot of fun. So I've always wanted to be a doctor ever since I was in kindergarten. It's the only thing I've wanted to do. I was always the one as a kid treating my friends. If they got hurt, they would come to look at me for help. And I think just that has carried on throughout life. I enjoy neurology because of the patients that I treat. I like the diseases that I treat. I like treating the patients because we treat a lot of chronic diseases, and so we see patients for many years. I like meeting their families and helping take care of the families as well as the patients. And then I like it that neurology is a really expanding field. There's been a lot of new treatments and options and technological advances with neurology over the last 10 years. The way we treat people now is much different than it was 10 years ago, and I like the excitement of what's going to be happening in the next 10 years and what other options that we're going to have for our patients. When I first see a patient, the first thing I like to do is try to make them comfortable. Most of the patients that I see have chronic neurological conditions, things that maybe they've had for a while, or they're coming in for the concerns of maybe having a chronic neurological condition. And a lot of people are really apprehensive or nervous. And so I always try to come in, introduce myself, make them feel a little bit comfortable before we start kind of talking about the reason that they're there. I really enjoy working at the Nebraska Medical Center. It's a great place. I like it because it's cutting edge. There's new therapies, new treatments. There's lots of doctors with lots of different specialties. And I like that people come from all over the world here to get treatment. And I like being a part of that.